Hi, this is Dr. Fred from Cleveland 13. May is Mental Health Awareness Month, and it's an important reminder that mental health is just as important as physical health. Unfortunately, many people still view things like anxiety, depression, chronic stress, burnout, emotional exhaustion as a personal weakness, but it is definitely not. Mental health is deeply connected to biology, lifestyle, environment, stress exposure, sleep quality, physical activity, nutrition, even social connection. And right now, many people are struggling. Modern life places us under constant stimulation and chronic stress. The problems of the world are literally in our palms 24/7. Many people are overworked, sleep deprived, sedentary because of their careers. Social isolation is a big problem. People being overwhelmed by all this information and constant connection with screens and notifications, it's almost too much. Over time, that chronic state of stress can begin to negatively affect both your brain and your body. We know for sure that mental health and physical health are completely interconnected. Poor mental health can actually increase the risk of things like heart disease and obesity, diabetes, chronic inflammation, sleep disruption for sure, and even impair your immune system functioning. At the same time, poor physical health can worsen things like anxiety and depression, fatigue, and even emotional resilience. But there is some encouraging news here. Lifestyle interventions can be very important and very powerful in terms of supporting mental well-being. Regular physical activity has been consistently shown to improve mood, reduce stress, improve sleep quality, and support cognitive function. In many cases, exercise acts almost similar to an antidepressant because it's influencing neurotransmitters like serotonin and dopamine. And obviously, sleep is super important. Chronic sleep deprivation dramatically increases the risk of anxiety, depression, and emotional instability and burnout. Also, nutrition is super important. Diets that are heavily based on ultra-processed foods or excessive alcohol and just overall poor dietary quality are increasingly associated with poor mental health outcomes. And as we hear about a lot, social connections really do matter. Humans are not meant to live in chronic isolation, and even though we're so connected, we are more isolated now than ever. Meaningful relationships with community, with faith, family, friendships, and those emotional support systems play a really important role in our psychological well-being. Mental health is not just thinking positive. It's about creating an environment, both physically and emotionally, but also socially and biologically, that allows our brain and our body to function properly and synergistically. More importantly, there is no shame in seeking professional help when needed. Therapists, psychologists, psychiatrists, counselors, these support systems exist for a reason. Asking for help is not weakness, it's self-awareness. This Mental Health Awareness Month, I encourage people to take their mental health seriously. Prioritize sleep, move more, eat better, try to reduce stress in those facets, right? Do things that help support stress reduction. Avoid constant digital stimulation. Connect with friends and loved ones. And if you need help, seek it. Your mental health is the most important factor of your overall health. And as always, I'm here to help.